All right. Hello, Dr. Maya Ziegler of Monarch Family Chiropractic. Welcome to tonight's workshop. It is titled Spinal Hygiene, and it's really about knowing your numbers. And so if you have your file handy where you've got your initial exam diagnostics, any re-exam diagnostics like your posture, your core score, any of those things handy, this is a great workshop to bring those with you and to look at them together, because we're going to go over your numbers today. And where this workshop came to be is, you always hear from, say, the American Heart Association, do you know your numbers, right? Do you know your blood pressure? Do you know your blood cholesterol? Do you know your blood glucose, your weight? Do you know your numbers? And I was thinking about that through the lens of chiropractic. Do you know your numbers in terms of your spinal health? And what numbers, or what are those categories that you would want to assess in terms of evaluating the health of your spine, your posture, your brain and nervous system? So that's what tonight is all about, is knowing your numbers. And I also want to loop into that a fitness assessment, because there's some research out there showing as it relates to walking or push-ups, an exercise that we'll go over called sitting to rising exercise, that will tell us your level of vitality and longevity, your health. And so just doing some of these things can really give you a nice report card of your overall health and well-being. The fact is, nearly 90% of Americans are at risk for chronic disease. Chronic disease being cancer, being heart disease, being anything chronic that we endure. And the definition, people are always surprised by this, but the definition of chronic is 3 months. So it's not very long. If you've experienced anything for 3 months or longer in duration, you are considered in the umbrella of chronic condition, right? And so when you're talking 90% of Americans are at risk for chronic disease, that's a big number. That's 9 out of 10 of us. And so if we have ways to measure functionally measure your health, not just how we feel, but how we function, then you are in a good camp. You are more, I guess you're more present, and health is more mindful, more intentional than the average person out there, right, is really living numb and doesn't know about how their health is so much more than how they feel, right? The leading cause of death in this country is heart disease. The first symptom we get is a heart attack. And so if we are symptom-based, that alone will tell you, that it's a big deal, right? So let's get into this. And like I said, if you've got any of your diagnostics handy that you've received in our office, then bring them alongside. So one of the biggest things that we assess when you come in is your posture. It's part of the consultation, part of the screening process to see if you are the right fit for our office, if you're showing signs of subluxation, because posture is a window into your spine, okay? And so if you look at this here, this is a picture. This green line here is that plumb line, right? We drop that green line from the ceiling. And if we look at where your body is in space compared to that plumb line, we're looking to see, do we see you shifting left or right of the plumb line? Do we see you shifting forward or backwards? Now, just so you know, when we are born, right, we're born with a primitive brain, and it takes a year plus for our brain to develop. In fact, it takes decades for our brain and nervous system to develop. Boys finally fully develop, into their early 20s, right? So, but the first year, the first 1,000 days are most critical. And you look at how a baby is when they're born, right? They're in that fetal position, right? They don't have control, right? The most sophisticated tool they have to survive are what's called primitive reflexes. So if you were to take a little baby and rub their cheek, it's called the rooting reflex. They turn, because that's the most sophisticated tool they have to find food, right? They're searching for mom's breast. And so when we go through development, we go from this forward flexion to lifting our head, lifting our chest. We start crawling, army crawling, standing, walking. So as we get more extension into the back of the body, we're more upright. That indicates a healthy, not only posture, but it indicates a healthy brain. So posture not only tells us mechanically, structurally, if there's any distress or distortion, but it also tells us how your brain's doing. Okay. So abnormal posture, this is all from research related material. If you have abnormal posture, we see increased muscle activity. So that's increased contraction, muscle spasm. This is rigidity. This is vigilance. This is protection. So this is you burning off a lot of energy in your musculoskeletal system. Okay. We can see disc injuries. We can see scoliosis, working injuries, lifting injuries, sports. And of course we have the pain, the back pain, neck pain, headaches, carpal tunnel, shoulder and ankle injuries. So just by evaluating posture, we have all of these conditions that are associated with distorted posture. And again, we look at how's that impact the spine, ultimately how's that impact the brain. And so if you evaluate or just take a look at anybody walking around today, you'll see that we've got a lot of people who have sick brains and sick posture. And you can really identify just from their posture alone, what's going on with their health. And this is interesting, right? Posture is not just our moms telling us to stand up straight. They've done studies to find that if you are older, so if you are more mature population and you have an increased kyphosis is that curve that we see in the thoracic spine. So if you've got an increased rounding, right, you're really pulled forward, and you couple that with a respiratory disease like bronchitis, asthma, maybe you get a cold or say a coronavirus that impacts the lungs. You couple this structure with a respiratory disease and you're more mature in age, then you are 144% more likely to die of that condition. Wow. And what happens here, right? We decrease the space that our organs have to do their work. They are working harder, right? And if we're carrying extra weight, our organs are insulated, right? So it's like they are hot. Like think about you trying to perform at your optimal level and you just ran a marathon, right? You're totally fatigued, totally tired, but you can't stop, right? So when we're holding extra weight on our structure, we've got postural distortions, we are stressed, then that's a cocktail of really dis-ease and an unhealthy combination. So posture tells us a lot. And that's why we care about posture, and that's why we evaluate it. Posture is a dynamic measurement, will constantly change depending on what's going on in your world. And it is so vital and so important that you have healthy movement in your spine. You're carrying yourself in a really balanced and aligned way. Because as we get into movement in a couple minutes here, you'll understand why. So let's go here quick. So we evaluate you. Most people were sent out for X-rays either initially or at some point in their care. And we want to know what's going on with your structure, because X-ray is a static measurement of how years and decades have impacted your structure over time to show us if there's any degeneration or arthritis. Now, most people think arthritis is normal. It is not normal. It is common. It is common in this day and age to see a lot of people with arthritis. In fact, one of the youngest persons that one of my colleagues actually has seen with stage 2 degeneration is a 12-year-old boy. It's pretty scary when we see that at 12 years old, still developing. But spinal degeneration happens over years and decades. Okay. Phase 1 degeneration is the only phase that is considered reversible. The only phase. Once you get past phase 1, you are considered permanent damage to your spine and structure. And so then it's about stopping any progression. Okay. The key point about phase 1 is that you typically don't have any symptoms. You don't feel anything. And it's not until you get into phase 2 where you start to feel something. What do most people think is that it just started, when in fact it's been going on for years, maybe decades, and you're at a reversible stage of, arthritic change in your spine, right? And so by the time you're getting into these later phases, you're talking about years and decades of work ahead of you. So that's where we want to first address what is going on with your spine. Can we support any changes if there's phase 1 degenerative changes showing up, and can we stop any further progression, right? So number 1, X-rays help us evaluate for that spinal degeneration, helps us also get an idea of how long we're talking in terms of healing time. And it gives us an idea of how much stress your body has been under in the years that you've been living, right? And what's great about X-ray, I have somebody that we X-rayed on their initial exam, and then about 12 to 15 months later, they got into a car accident. So we said, let's take another set of X-rays. And we actually saw progression of degenerative changes in that 12 to 15 month time frame. The likelihood of it coming from the accident is pretty low. Typically with accidents, we're seeing more acute injuries, breaks, that sort of thing. So it was really a wake-up call to see in 12 to 15 month time frame, with receiving chiropractic care and taking on some, good spinal hygiene outside of getting adjusted, she had progression. So that right there was an indicator to her to say it wasn't enough. She needed to do things differently. She needed to change what was going on in her environment, in her world, because it was impacting her structure. So that's where having baseline assessment, objective measures that really tell us more about your numbers and your health are really great. So X-rays are really important. The next one we look at is we do a core score, and a core score is broken up into 3 separate measurements. And this is more of a dynamic measurement of, so think about X-rays as static, right? It's how you've been impacted over time. You can't necessarily change what you're seeing on X-rays, right? Core score is looking at how is your brain and nervous system overall adapting to your environment in the moment, right? We look at the autonomic nervous system, the branches of your sympathetic and your parasympathetic, and we see, are you looking at the world through a lens of one dominating over the other? And how does that impact the rest of your function? And it looks at how much reserve, how adaptable you are to your world, okay? So overall, you get an overall core score. And when we break it down, we first look at heart rate variability. Now, if you guys have your core score handy or one of them handy, look at that second page, because you're going to look at this picture, this chart. And typically, if you haven't chatted with me about your core score recently, then this is new information, because this is what I've been sharing more recently. So there's really 3 categories, or excuse me, 4. I've labeled 4. If you were to put a line across here, I don't know why my line isn't showing up. Let's give you a line here. Do this one right there. So there are 4 quadrants that we're really looking at. Okay, 1, 2, 3, and 4. This 5th right here, if we were to give 5th quadrant or category, it'd be this green box here. Now this black line is separating what we call sympathetic function with parasympathetic function. So if you ever hear of the autonomic nervous system, the autonomic nervous system is made up of these 2 branches, sympathetic, parasympathetic, and recently there's a 3rd branch called your polyvagal social. But we won't go into that just now. So we ideally want you charting along this black line in this green box here. If you happen to fall into one of the quadrants, it gives us an idea of what's going on in terms of your function, how adaptive or what is your adaptive state, Okay, so let's look at this first one, uptight. So this first quadrant is considered a nervous system that is in an adaptive state that we define as uptight, meaning you're charting higher up here, which indicates higher adaptability, right? So you have high adaptability, you're responsive to your world, and you're shifted over on this left side, which indicates a lens of sympathetic function. Okay, so you have high dominance of a sympathetic state. So you're looking at the world through eyes of stress, of protection, of fight or flight, survival. Okay, but you've got high reserve, right? You're charting up higher here. You've got high reserve, high adaptability. This is considered an uptight state, meaning there could be a level of anxiety that you experience, and it could also indicate or indicates that your body is in an overtraining type situation. So you're working your body. Right now it's recovering some, but it's stressing the system where it's requiring some level of vigilance, some level of stress, okay? Quadrant 2 is shifting on this other side of parasympathetic function, and it's considered an exhausted state in terms of nervous system. And this means that you've got a parasympathetic dominance. So parasympathetic is a rest and digest state. It is active after we eat, active at night. Okay, this is when we are relaxing. This is when the body is primed for conception, right? Because your nervous system thinks, oh, the next 9 months, I'm relaxed. I'm not in survival mode. I'm not stressed. This is a great time to have 9 months of growing a baby, right? There are different things that happen in each state. Both are important. But when you are dominant in your parasympathetics over here, that means you have an inability to respond to stress. Okay, you're deficient in your ability to respond, meaning you're probably fatigued, you're exhausted, you're unresponsive to what's going on in your world. Okay. Quadrant 3 is considered a distress state. Now we've dropped below that line. That indicates you have low reserve, poor adaptability, okay, and poor vagal tone. Vagus is that cranial nerve 10, which really stimulates all the parasympathetics, really, again, anchors you in, slows you down, right? You are definitely not in that state. You are in survival stress mode, but not high adaptability. You got low adaptability, low reserve, and this is you living out of balance, but really living off of adrenaline. And this fourth quadrant, this is considered a weakened state, poor adaptability, poor responsiveness to stress. We could consider it like a vegetative state, but this is really considered a precursor to a health event. This is a medical state. So a lot of people in this, that we see are living in quadrant 3 over here. They're in a lot of distress. Listen, if you are distressed, not just months, but years, at some point your body no longer responds to cortisol, the stress hormone, and you shift over here to category 4. That's typically adrenal fatigue, if you've heard of that. And this is a problem because this means you are primed to some type of disease process, right? If not, you're already there. So understanding where you're charting is really important, and understanding how you respond depending on your environmental activities is also a big deal. Some people will say, no, I don't want to do this re-exam because I'm really stressed. No, this is not a good time for a re-exam because there's a lot going on. And that's where I say, no, this is a perfect time for a re-exam because I want to know when you feel like you are under stress, I want to know how your nervous system is functioning. It's perfect. And I also love when people think, oh, I feel great. Things are great. I'm doing great. I say, this is a perfect time for a re-exam because I want to see when you are in this state of, I think everything's great. I want to see how your nervous system is functioning because we care about how you feel, but that is not our driver. We're looking at function here, right? So let's keep going here. So core score. Next is a surface EMG. This looks at muscle tone and balance. How efficient, how much energy are you consuming when you're just nice, comfortable seated posture? Now, when you look at this white line is where your pattern should be. Okay, the black line is where your pattern is, right? If you go outside that white line, there's green, blue, and red, mild, moderate, severe stress. When you get out here, again, this is increased tone, this is hypervigilance, this is muscle activation, this is contraction, this is spasm, this is tons of energy. Your body is utilizing a ton of energy to, in that posture, to create some level of stability within your structure, okay? So if you look down here at total energy index, it gives you an idea of how much energy your body is utilizing. We want that to be 100. 100 is optimal, okay? Now, this person, we're seeing areas of high activation into their low back, but then you see it drops into this yellow line, okay? This yellow line is actually the opposite of increased tone, right, that I talked about. It is where you have increased tone, lots of muscle contraction, lots of muscle engagement. This is the exact opposite. This is compressive in nature. This is a muscle that's flaccid, atrophying, right? It's not doing its job. So you can see up here in this upper cervical spine, there is no musculature that is getting turned on because there is a complete disconnect between the brain and the body. And a lot of times we see that if you look at this right one, a lot of times we can see that through this core area. And some people will say, oh, I need to work out my core more. I need to do more core work. And while, yes, I think working and moving the body is important, but if you have a subluxation or you have a disconnect between the brain and the body, and the brain's not turning this musculature on, then how well are you going to be able to do that core work, right? Last one, this is how deep do we see stress reaching into the layers? This is deepest layer of your nervous system. This is the portion of your nervous system that regulates immunity and also manages organ function, okay? If we see stress reaching into this deepest layer, number one, it gives us an idea of how long the stress has been around. And number two, how potentially stress state you are in, right? How much work needs to take place to get you, for you to get into a place of vitality, health, and ease, right? This is a system that, you know, especially when we're looking at the score of 91 versus a score of 59, this is a stress state, right? Clear as normal activity, that's what we want. Let me go back. When you see greens, mild, blues, moderate, reds, pretty severe. So this person is under some pretty significant stress. Let's just go back again. Why are we going over this? We need to have more objective measures when it comes to your health. We can't just base it on how we feel, because feeling is literally the tip of the iceberg. When you go deep into that water, you see, whoa, this is a bigger problem, right? So when we start getting data on your function, we put that data over a care plan, right? Over a year, then you continue to do the work. We have to get data over years. That's where we start to really identify and see how you're doing in terms of health, right? Health is, and taking care of your body is a lifetime investment in everything, time, energy, money. It takes work. And so it also takes work in a different way to, you know, be unhealthy, to be in a disease state. But your body is so intelligent that you don't know you're in that disease state till years down the road, right? And we also live in a world where it's pretty easy to be unhealthy. So spinal movement. Movement is so important. We were meant to move. We were meant to be flexible, have motion and movement globally and segmentally, right? If our spine isn't moving properly, that sends inflammatory signals to the brain that literally mean death, cell death. And so when you look at arthritis or lack of movement in the spine over decades, it is literally death. And so when you don't have movement in your spine, I want you to think about this. Movement is life. When you have lack of movement, that is slow death over time. And so your spine should have ranges of motion that are appropriate, and it should move all the time, frequently, intensely, on a daily basis. If you are human, you should move. If you are older, you should move more. And if you are injured, you should move the most. So your spine should move. And I've been telling this to everybody. Think about your day-to-day activities. If you are sitting at a desk for 10, 12 hours, then going home, sitting and watching TV or whatever it may be, if you're standing all day long, think about your activities. You are intensely training your body, intensely, over and over and over with your repetitive movements and your repetitive postures. And if you are not equally and intensely training your body in an opposite way, then you are introducing slowly over time stress to a system. You need to move, period. And no adjustment once a week, 3 times a week, every day, once a month is not going to be enough for what you're doing on a day-to-day basis. So spinal hygiene is a non-negotiable, period. You need to move. There's plenty of things out there. But if you are not moving your body, then you are slowly or maybe more swiftly moving yourself towards a more diseased state. And now you can get an idea of why 90% of Americans are at risk for chronic disease, because we are overweight, we are not moving as much, we sit, we have technology. Our life has made it real easy for us to be lazy, but our body needs to be challenged every day, all the time. When we challenge it, we are striving for greater levels of health and vitality, right? And this literally, when we're talking about arthritis, when we're talking about spinal movement, subluxation is poor movement, lack of movement, no movement, right? Subluxation is a slow death. And so that is what chiropractic is doing, is it is introducing appropriate movement into a joint and putting appropriate sensory input into a brain for a brain to better respond and process your world, right? So good thing you're getting adjusted. Okay, we do balance, right? Balance is testing our proprioception, which is basically our 6th sense. So like, I know my hand is behind my back, not because I can see it or taste it or smell it. I just know. It is our brain's ability to understand where our body is in space, right? And so as we get older, what is the biggest thing we're concerned about? Somebody falls, we're concerned about a hip fracture, because we find that that is literally a cascade of events happen after somebody falls and breaks their hip. It's like a cascade of events of disease and slow death. And why do we see that happen with our older folks? Because of loss of balance and proprioception. So understanding that our brain knows where we are in space is vitally important. And so that's where we check balance. Balance, you should be able to hold one leg up, eyes open, eyes closed, no problem. Left and right side. Okay. And so that's why balance is important. Our eyes are the main sensory input into our brain to understand where our body's in space. So when we take our eyes out of it, our brain has to use different neural pathways and different sensory input to get the same information. So when you take your eyes out of things and you experience things more challenging, that's why. So we need to make sure we're engaging our body and getting appropriate movement so it can support healthy proprioception and balance. Okay. Dynamometer. This is grip strength. So grip strength, people think, oh yeah, I need to work out, muscles on my forearm. Actually, we're looking at grip strength because the nerves that exit out of the spine are the nerves that activate the musculature of your grip. Okay. So we're looking at cervical health. And for your age and being a man or a woman, there is a normal there. And we're actually seeing that grip strength is a frailty marker in our older populations. If we see an 11-pound decrease in your grip strength, it's linked to 60% higher risk of dying from any cause, including heart disease, stroke, and heart attack. So that's something that we really assess here every re-exam is your grip strength. we look at cervical health, but cervical spine health, but we're also looking at, okay, do we see a drop? What's going on there? Is that a red flag, or is it just, an exception to what is going on in your world, right? That's why we do an objective measure of grip strength. So I hope that gives you a broader understanding as to why doing more functional measurements, doing more objective measures of your health as it relates to your chiropractic care, why we do that, right? I've got some really great data on people that are years of data. And we can pinpoint, oh, this is what was going on when this happened. This is how it affects your health. This is what you need to do when this happens in the future. You need to be more cognitive and more intentional with X, Y, Z, because it impacts your brain and nervous system in a way that really shifts you into more of a diseased state, right? Got some great data. And when you get chiropractic care here, and we are measuring that on a regular basis, know that over time, as long as you are holding yourself accountable and committing to the process and just have the wherewithal of, oh yeah, I'm going to move today. Oh, I'm going to show up on a workshop because it holds me accountable to being the best I can be, right? It holds me accountable to doing my spinal hygiene, or I'm more consistent with healthy things, right? Down the line, you are on a trajectory of health that your counterparts who aren't showing up here, probably aren't. So I just want to go over this fitness assessment, movement, 30 minutes a day. That is what the U.S. Department of Health and Human Services say are required for physical activity. And for adults, 65 years and older, they're saying 150 to 300 minutes. And that needs to be short bouts of energy on balance, aerobic, and muscle strengthening. That might be a week, 150 to 300 minutes. I'm not sure. I'll have to check in on that one. But if you're not getting 30 minutes a day of physical activity, that's a problem. Second, walking speed. Walking is the 6th vital sign. So if you are not, I believe normal speeds are 1.2 to 1.4. And if you are walking slower than that, or you don't walk a mile in a certain period of time, you are at risk for cardiovascular disease. I'll have to look that one up too. But walking speed is really an indicator of health and vitality. Got a little excited there. Sorry about that. Push-ups. They did a study and they found that men, this was firefighters actually, men who could do 40 consecutive push-ups had a 96% lower risk of cardiovascular disease compared to those who could only do 10 push-ups or less. So if you are maintaining a level of fitness where you could do consistently 40 push-ups, guess what? Your risk for cardiovascular disease is like almost 0% compared to somebody who could do 10 push-ups or less, right? So again, what is your fitness level? You need to move, you need to walk, and push-ups might be a great guideline for you to evaluate where you stand. This last one, because I know I'm running over here. There's something called the sitting rising test. And this is something that was done to really evaluate the health of our older population. And they say, it is well known that aerobic fitness is strongly related to survival. But our study also shows that maintaining high levels of body flexibility, muscle strength, power to body weight ratio, and coordination are not only good for performing daily activities, but have a favorable influence on life expectancy. And I believe they found that, if you weren't able to do this sitting to rising test without using your hands, then your likelihood of death was like, I think they put a number to it, like less than 5 years or something like that. That may be worth checking into. I hate to say that, and that might be worth checking into. So I'll check into that, and if you're in the office, I'll clarify that. But what you do is you start standing. You want to go to a sitting cross-legged position, then you want to go back up without the use of hands, knees, any extremities. And if you do this test and you have to use a hand or a knee, you take a point away every time you use something to help yourself up, right? They did this study in our older population, but I think it's a good, easy thing to do to just check right away. Hey, can I sit down and stand up without the use of my hands? It's a good gauge of overall fitness. So I'm going to stop there. I've gone over my time, but this is where I want to end, because the biggest thing in putting together this workshop and really looking at longevity, right? Knowing your numbers. I hope when we, just take each item that we do with the exam and you compare it to where you are. My hope is that you have a goal that you can strive for to challenge your body more. And I hope that you recognize that you making the decisions that you are and showing up for your chiropractic care, recognize that as, give yourself some kudos here, because it is an investment in all things to be consistent and show up in a very honorable way to take care of your body, right? Preventative health, alternative healthcare, wellness and vitality and longevity are not just handed to you. It is not just earned, right? You just don't get it. You have to work for it. And so by you being a part of our community and part of our practice, you are working for it, you're showing up for it, and you're showing up here. I appreciate that. So thanks for staying with me as I have gone over tonight. I just lastly want to say we're in our expansion cycle. Expansion means we are looking to expand our community. We want to reach out to those who maybe don't know the importance of chiropractic, maybe want to experience something more for themselves and their family, maybe don't know there's another way, maybe are without hope. We want people in our practice to have more. And the way that we can do that is through you. If you're just here to help yourself, yes, I'm grateful that you're here taking care of you. But if we don't help our community, then what is it? What's our reason? What's our purpose, right? We got to bring people alongside us. So my challenge to you is please share a workshop. Please share about our office, send somebody to the workshop, bring somebody into the office. But if you haven't had your spine checked, then we believe everyone should have their spine checked first and foremost. Then they can make a more informed decision. So please share what you know. That's most of the time how most people hear about us. So appreciate you for being here tonight, and I'll see you next time. Dr. Mike and Ziegler, Monarch Family Chiropractic. And for those of you guys showing up in the workshop tonight, bring your questions in. I'd love to answer them.